So first of all, my name's Lindsey Reece. I'm the project lead for the Active Everday project, and I'm based at Sheffield University. And I'm here today to talk about Active Everday. The name says it all really. The project is designed to help make it easier for local people affected by cancer to become more physically active. Now, to start with, we went out and we spoke to people affected by cancer and healthcare professionals to really understand what support they wanted around physical activity, and if we were to design a service, what that might look like. And what we found was that even when people were aware of the benefits or wanted to become physically active, there was an unmet need between actually how they go about doing that. Where do I go? Who do I speak to? And what's available to me? And that was how Active Everday was born. Now, Active Everday is jointly funded by Sport England and Macmillan, and it has the primary aim of piloting an innovative pathway to help people to become physically active. It takes quite a novel approach in the sense that it is a pilot, so we're learning as we go, and we'd like to hear from you guys how we can improve it and what we might need to help better the needs for people to be active. We were successful with the funding last summer. The project went live the 1st of January this year, and we have funding until the end of summer next year. So we have about 18 months of delivery time. So the core elements of the project really focus on three main areas. It's firstly to work with healthcare professionals and patients to develop a physical activity pathway that is safe and appropriate for patients. We have a core piece of work around supporting professionals to raise the physical activity conversation, and that might be through supporting the existing resources we have available, or it might be through identifying a training gap and offering support for professionals to have that conversation. And finally, it's about broadening as a city our physical activity and sporting offer. Now, we can only do that through the partnership works we have across the city. Now, we're quite lucky in Sheffield that we have a broad range of organisations that are all committed to help get our city moving. And you can see on here that we have such a broad range of skill sets, and what we want to do as a project is really come out and work with you guys, and let's bring us all together, and let's work together to help people in Sheffield and the surrounding areas to become more physically active. Now, I apologise for the rather complicated slide. In essence, what I wanted to do here was really take a magnifying glass and look deeper into the project and go, well, actually, what's this all about? So if I try and simplify it for you, in essence, we have a broader piece of work going on in the city around training and awareness and trying to help everybody have that conversation about physical activity. Really at the centre, we have the patients and we have the people affected by cancer and what their journey might look like. And as you can see, somebody can refer themselves into the project. So if an individual wanted to be active, they can do so themselves. They can be referred through by an AHP or a community rehabilitation group, or all health and social care professionals can refer in. And what happens is that referral comes through one central physical activity triage point. So anybody that's referred for activity across the city with a long-term condition comes through that one simple, easy pathway. And what that means to that patient is it gives them an opportunity to talk to someone about moving more. That doesn't necessarily mean they're going to be put into the gym and on a treadmill. That's there if they want it. But it's about having that conversation and having that opportunity to have that conversation. And that can be done through having a one-to-one chat, or it could actually mean by going to an exercise and cancer specialist that's trained in level 4 that can give you a tailored, personalised plan. And then that opens up all the doors across the city to look at what's available. And that's right through from a local community walking group, right through to a structured physical activity programme or a sporting opportunity in the community. Now, this is what the referral form looks like. So what it means to you guys is actually, if you feel it's appropriate to talk to someone about moving more, then you can hand out one of the project cards that's around on the tables. But this physical activity referral form is the single form that's used across the city. So if you're currently using it, please continue to do so. We have amended the form so it explicitly states on there cancer, and it's on electronic forms. We have paper ones, so if you'd like them within your teams, let us know, we can come out and we can give you them. And the idea behind this is to really make it as simple and easy as possible to have a conversation, fill in the details, and get that person having the physical activity support. So that's what these look like, and there's one for individuals and there's one for professionals. We have a Active Everyday website, and the pages on there all talk about the project, and it's housed on the city's physical activity website, which is the Move More Sheffield page. So I would please encourage you to have a look on there. There's information about general guidance on physical activity and cancer. There's an opportunity to meet the team, so you can see the trained specialists that are working together on this initiative. And you can also refer yourself on there or signpost a patient to refer themselves. So that's a whistle-stop tour of Active Everyday. I hope what's really come across is that as a city, we're committed to having this conversation about moving more. The support is there. We would like to make this as easy as possible to signpost patients to help them to become more physically active. And please do follow us on Twitter. Thank you.